pandemic, but it's really skyrocketed and will remain with us well after the pandemic is over. So today we're going to talk to some amazing experts in this field and shed some light on some of the major challenges we're facing in this country, and then have a great discussion on some of the innovative solutions to these challenges. So I'd like to start off by thanking our panelists and members of the media in advance for their participation today. In addition to myself, we're going to talk with 4 other national advocates for families and children. We'll spend a few minutes with each advocate diving into a range of issues, including the childcare crisis, women in the workplace, families with medically fragile children, and mental health. And in the second half of the session, we'll explore solutions to these challenges and also provide an opportunity for some Q&A. So I'm Fred Johnson. I'm the president and CEO of Team Select Home Care and the co-founder of a nonprofit called the Unforgotten Families, or TUF, TUF for short. Most of my work at Team Select and the Unforgotten Families is centered around providing home care for families and children that are medically fragile, and through the TUF Foundation, trying to make the world a better place for medically fragile children and their families. So I'd like to start off with some introductions of our other 4 panelists. Joy, would you be so kind to kick us off, please?
Yes, hi, good morning, everyone. My name is Joy Burkhard, and I'm the founder and executive director of a nonprofit organization called 2020 Mom. I also have the great fortune of founding and helping to lead a movement for mothers' rights called Mom Congress here in the United States. It's a pleasure to be with you today, Fred, and my colleagues.
Fantastic. Great to have you, Joy. Missy, could you go next, please?
Yes, good morning. Thank you for having me. I'm Missy Narula. I'm a mom of 3 little kiddos, and in addition, I am the founder and CEO of Exhale Parent, which is a site for all the information new parents need, really starting with maximizing maternity leave and paternity leave. I am a big advocate for paid family and medical leave, and I'm also on the board of a nonprofit that is fighting for paid leave for all. And I'm excited to be here, especially today on the day that Biden is talking about the American Families Plan. So it just feels like everything's coming together.
Right. Fantastic. Great. Lourdes, how about you?
Yes. Hi, good morning. I am Lourdes Vizcarra. I am in Albuquerque, New Mexico, and I happen to be a family medicine physician, but that is not why I am here today. So I'm glad to meet a lot of you for the first time today, and some of you I've known before. I am on the board of directors for Heroes Path Palliative Care, a new nonprofit in New Mexico, who is hoping to work on some of the issues that we'll be talking about today, such as respite care and other things in terms of supporting the quality of life for families and children in New Mexico who are medically fragile. And thank you for inviting me to this today.
Fantastic to have you. And last but not least, Jen.
Hello, everybody. Thanks for having us on. I'm Jen Bartz. I'm first and foremost a mom, like the rest of the panelists. And I'm just excited to be able to share about our journey and what led us to start a nonprofit. My son James is the inspiration for all of that, but my other children also inspire what needs to be done to support the entire family for children who are medically fragile. So thank you so much for having us on.
Thank you for being here. So let's move to slide 3, please. Most of us and our listeners are familiar with how the pandemic has caused significant childcare challenges for families. So I'd like to start out with you, Joy. As many of these challenges existed well before the pandemic, you were way ahead of the curve and have been highlighting and advocating for these families, parents, childcare, and mental health dating back to when you formed your first nonprofit, which I believe was back in 2011. You've also been recognized with some really prestigious awards, the American Public Health Association's Maternal Child Health Advocate of the Year Award in 2019, the federal government's Emerging Leader Award from Health and Human Services. So could you tell us a little bit more about the work you've been doing?
Yeah, I appreciate it, Fred. And Mom Congress, again, the mother rights movement that brings the voices of mothers to DC each year to talk about these important issues, was founded around the notion of several important issues. And one is really around the issue of affordable quality health for our children. As all of us can attest to, as mothers, we often feel like the forgotten ones. And as you've said, Fred, and we'll get to hear from the other panelists, those with medically fragile children are especially the forgotten ones. We believe that everyone should have access to affordable childcare, and that the COVID crisis just exacerbated the issue for all of the world to see, and including business owners, HR leaders, managers who were attempting to support the work of parents as employees during this really difficult time as children were home. We believe that not just a child care center bailout is necessary. We've got to stabilize the existing system, but we also need to reinvent the system that was already failing mothers. So just a real pleasure to be here today. And Fred, as you alluded to, we know that the mental health of mothers because of this challenge has really been suffering in 2020 and 2021 at greater degrees.
Definitely. I actually saw an article last night in the Wall Street Journal that mentioned, I think it was 1.5 million women who and mothers who had to exit the workforce due to the pandemic still have not returned to work and may never return to work at this point. Is that similar to what you're seeing out there, and is your group helping to address some of those issues?
Yeah, it's a really great point, is that women are not returning to the workforce as we would have expected. So many had to leave because they didn't have the choice but to support their children at home. The statistics say that we're back to 1980s level of engagement of women in the workforce, and this hurts the U.S. and it hurts the U.S. economy, and it hurts U.S. families potentially too. You know, I think women, what we're finding, moms just aren't sure what to trust yet, and it's going to take a while for them to feel like they're ready to start exploring the job force again, because things have been flipped with homeschooling and childcare and too many times. So I think it's going to be another year or two before we start to see women return, and we want to make sure that they have the options that they prefer, not just to childcare centers when they are ready to return to work. Excellent.
So yeah, looking forward to the second half of this presentation when we get to some of the solutions and learning a little bit more about some of the areas you're advocating for to help address these issues. So let's move to slide 4, please, and let's talk a little bit about women in the workplace and continue on with this topic. Missy, you've had a fascinating and successful career, first leading large global companies, and then becoming more of an entrepreneur and advocate for parents and families by founding Exhale Parent in 2019. What motivated you to make that switch? And can you tell us more about Exhale Parent and the mission?
Absolutely. So as you mentioned, I worked in big business for a long time. I was in investment banking and management consulting and private equity. And during my 8 years in private equity, I had 3 children and lived through personally how hard it is to navigate through your rights for paid family and medical leave. Right now, there is no federally mandated law to provide paid family and medical leave, and as a result, only 19% of civilian workers get paid leave. And I was lucky to be among those 19%, working for a really sophisticated and supportive employer. But even within that, I just found it so hard to navigate through the state level rights, the city level rights, the county level rights that were available. And I wanted to create Exhale Parent to help people navigate through those rights and really maximize their leave at such an important time in parenthood.
That's fantastic. Are you noticing or gaining any traction to try to move that number up from the 19%? Frankly, I'll be honest, that's the first time I've heard that number, and it is shockingly low.
It's shockingly low, and as you peel back the onion, actually 95% of the lowest wage workers don't have a single day of paid leave, and that disproportionately impacts women and people of color. So we're the only developed nation in the world that doesn't have mandated paid leave for birth moms. It's really mind-boggling. But in terms of the progress, I'll point to 2 different areas. One is since as of today there's no federal law in place. More and more states are starting to introduce their own rights. And so right now only a handful of states have rights available, but that is starting to pick up. But on the other hand, today is a big day because paid family and medical leave will be included in Biden's proposed Americans Families Plan. And it's such a big deal.
Yes.
And it's not just for parental leave, it's also for taking care of a sick family member, taking care of yourself. And I think, stepping back, the scaffolding of this country is so frail when people can't afford to take care of their children, be it a new child, be it a medically fragile child, be it a spouse who needs support, be it yourself coming out of a surgery. And so I think this would be such an enormous step in the right direction to really fix the building blocks of the American workers.
That's amazing. Thank you for that work, and like to keep working with you and wish you great success in that. It is positive to see some good steps starting today. And you really helped tee us up for our next panelist, Dr. Lourdes Vizcarra. And Lourdes, Missy, you really mentioned people exiting the workforce and providing unpaid care to, whether that be medically fragile children, whether that be parents, siblings. There's all sorts of hidden caregiving going on in the country that has massive effects on families, on incomes, on the economy. And Lourdes has some real personal experience with this and the story to share. So Lourdes, you've become a powerhouse of an advocate for these families, really based on your own personal experiences raising a medically fragile child. Can you tell us a little bit more about that experience and how it led to your involvement in leadership roles with Heroes Path, Palliative Care, and the Medically Fragile Case Management Advisory Board, among others?
Sure. Thank you, Fred. So I would first love to start out with just a disclosure. I am an expert insofar as my story with my son, Sebastian. So I will make some general statements, but my perspective will be that of my family. There are so many different families with different situations. Our children may be medically fragile, but when it comes to the day-to-day details and work, it'll be different for each family. So obviously there'll be some overlap, but I just want to make sure that I speak to, this is my perspective, my family's perspective. So I'm an expert in that area. In terms of being a family medicine physician, I would honestly say that in no way prepared me to be Sebastian's mom. So that had a whole other different experiences and adventures that came with it, that just the fact that I was a physician, sometimes I've had conversations where someone has said, oh, you're a physician, so this must be pretty easy for you, or you should know, you probably already knew what to do. And I just want to say that was certainly not the case. And by the same token, those parents who may have not had any healthcare experience prior to also become experts in the care of their child. So I just wanted to make sure I put that out there. In terms of what it means for someone to be medically fragile, I believe each state has their own definition. In New Mexico, when we determine, or it is determined that an individual or child is medically fragile, it basically refers to the fact that they have ongoing needs that are met by a skilled nurse. So a skilled nurse would evaluate the child on a daily basis, if you will. They would make some sort of medical decision about what needs to be done. So in New Mexico, that's what that means, is they have an ongoing skilled nursing care need and need for reassessments, reevaluations, and medical decision processes. In terms of my story, being Sebastian's mom, one of my great loves, it started out pretty normal pregnancy. Everything was going fine, planned, until the very end of the pregnancy when it wasn't. The primary diagnosis was that of congenital heart disease. And over the course of time, we had many other diagnoses added, from cortical visual impairment to the intellectual disabilities, cerebral palsy, seizure disorders, etc. So as time went on, not only did the medical conditions or list of diagnoses increase, the number of medications and the frequency of medications also increased with time, as well as specialized medical equipment. So eventually my son ended up needing a G-tube and therefore a feeding pump. As time went on and his developmental age or milestones were not met, he also required the use of a wheelchair. He was not able to communicate using words. Obviously, you do not need words to communicate, so we certainly had communication on a different level. And that just kind of progressed throughout time. He did die about 2 months prior to his 13th birthday, actually to the day, and that brought on a whole other adventure or need for other type of services as well. Somewhere in there, my son was allocated to the medically fragile waiver. It took about a couple of years, so that did not happen right away. Once on the medically fragile waiver, he did meet criteria, obviously, because of the medical fragile definition I already provided for private duty nursing. The issue with that, of course, is that we don't have enough nurses to provide private duty nursing in someone's home.
Right.
And depending on the level of care, right, the number of hours that are needed are different and specific to that child and that family. So that became a huge issue. It still is an issue. I am aware that nurses are not as many as we need are available anywhere within the nation either. So it's not just a New Mexico issue. At one point, we recruited our own nurse, and that's how we ended up with a nurse. So that continues to be an issue here as well as everywhere. And then in terms of professionally, initially it became maternal child leave for 3 months. And as other things happened and we found out that it was not just a congenital heart disease diagnosis, then it became family medical leave for a year. And then it became, I cannot go back to work given the needs of my child and what he would need 24/7 at home. So that was in my professional experience, so personal and professionally. I did step out of work. I switched over to a locum tenens position. So basically you're on call or a pool of docs, if you will, who can show up and cover. And that sort of switched, all of this combined together, right? My professional life, my personal life more than anything, and how do I put the two together? So that led to the question of what do I do with everything that Sebastian has taught me? And that's where the advocacy piece comes in. From families as faculty, teaching medical students, invite them into my home so that they can see firsthand what it's like in a home of a family who has a child who's medically fragile. From becoming a parent teacher with the School for the Blind and Visually Impaired. My son also had the diagnosis of cortical visual impairment. So sort of how do I bridge that gap as well? And also offer support groups for other parents in a similar situation, to the medically fragile case management program at UNM and being a sort of part of their family advisory board, to other things, including Heroes Path. And I became a member of the board of directors January of 2020. And the reason I was invited to this amazing group is one of our other panelists, Jen Bartz. She had a child also who was medically fragile who passed away. She and I had nurses provided by the same home nursing agency, and they put us in touch. And since joining the board of directors, we have done a lot of, in the trenches, put your working boots on, roll up your sleeves, and how do we bring changes to New Mexico to best support these families and these children.
Thank you. Thank you very much for your bravery in telling that story and for taking that situation and creating a longer term legacy for Sebastian and helping these other families, both locally and nationally, that are in need. Unfortunately, your story we see every day in my work at Team Select and how having a medically fragile child often unfortunately leads to divorce, leads oftentimes a much higher divorce rate, frequently leads to single parents having to exit the workforce in order to take care of their child, because as hard as home health companies can try, there's just not enough nurses out there, and the ability for hospitals to pay 30 to 50% more than home care can pay makes this challenge extremely difficult. And I think because medically fragile children represent, about less than 1% of the pediatric population, these stories don't really get told. And I don't think a lot of people are really aware of the compounding effects that this has on families and spouses and other siblings and the workforce and everything. So thank you so much for sharing that story, and also for teeing up your friend and peer and confidant Jen Bartz. So let's move to slide 6, please. And Jen's going to focus a little bit more on mental health. And Jen, similar to Lourdes, you have personal experience that Lourdes alluded to, that really led you to become a local and a national advocate. So we know you're the president and the founder of Heroes Palliative Care, a national board member for the National Coalition for Hospice and Palliative Care, board member and advocate on 3 other local organizations. So similar to Lourdes, you're really taking your own personal experience and using it to make the world a better place for other medically fragile children and their families. So can you tell us a little bit more about, maybe quickly about your experience and the issues you're working on? And I really see this topic of extreme caregiving that you're going to talk about. I see this every day with the families that we deal with, and excited for others to really better understand what we mean by extreme caregiving.
Yes, thanks, Fred. I think when I think of my son, he's right there. He's super cute. He's an active toddler. Like Lourdes' son, Sebastian, he died about 2.5 years ago now, but he had a vibrant life. He still is impacting his community. So I start off by saying these children, if we can allow them to have access to their communities, they're going to change our communities. They're going to make our world a better place. So while they're small in number, they are mighty, and they are well worth our effort and our time that we put into trying to get better services and better support for these families. And my son, James, you can't tell in the picture, but he had a trach, and the last year of his life, he needed a ventilator, but he still was running around. So imagine a ventilator attached to a toddler, and you've got a couple of feet between the machine and him, and we have to try to keep up with him. The ventilator's heavy. He comes with a suction machine and emergency medical supplies that's in a heavy backpack, and we're all trying to keep up. Children who have a trach, they need a lot of direct care almost all the time. If their trach comes out, for instance, you lose their airway. So you have to be very quick, and you have to always be expecting an emergency situation. So as far as mental health goes, that can lead to a lot of long-term stress disorder type things, because you're always heightened. You are always expecting an emergency with your child, and you have to be ready. Even as you try to get a few minutes of sleep, you're thinking, I need to be ready for an emergency as you sleep. So I think when you would walk into my house, you would see an ICU setting in my living room. You would see monitors set up. You would see machines hooked to my child. But then you would also see me smiling confidently at you, and you would see my son smiling confidently, and you would see my other children signing songs to him, and you would see a very normal family, but you'd also see all the stuff going on. And without nurses, without even a whole team, you've got an ICU run by parents. They are the doctor, they are the nurse, they are the social worker. They are the custodian when something spills. They're the aide. They're the people stocking all the supplies that you go through, sometimes very quickly in a day. So there's so much going on that they are responsible for that oftentimes they are not, the option to be mom isn't there. So I think that adds to the stress. Not only are they trying to be mom and everything else to their child who's medically fragile, they're trying to be mom and everything else to their other kids. They're trying to still be a wife. Forget about being a friend. That just doesn't happen for these families. You no longer have friends that, unless they're people who are willing to come and like serve you. There's not time for having fun and things like that. It's just all in. In an ICU, a nurse will have 3 shifts a week and they get to go home. They get to have days off in between. And for these families, it's just 24/7, 365 care. So home nursing is extremely important. But if you think about what these nurses are needing to commit to, yes, they have these fantastic kids and these fantastic families to work with. So sometimes that's enough. Yeah. But they're dealing with a pay cut to work in the home usually, like you've mentioned before, Fred. They're dealing with the added stress and the added responsibility of making all of those calls. You know, what happens when something changes with this child? There's the chance that there's an emergency going to happen and they don't have the full team behind them. They can't call out and say, I need help in here. They are the only nurse. So, and they often don't have paid time off like Missy talks about. They just don't, if their child at home is sick, they have to make a decision, and that means that the family that they serve isn't going to have what they need if they decide to call in sick. So there's a lot going on within this extreme caregiving world that really complicates how we can serve these families effectively. And it's even different state by state. So my son with a trach would not have been able to go home without 24/7 nursing already set up when he had his trach placed. But here in New Mexico, we just were sent home, we were trained. I was confident and comfortable with it, but I didn't fully realize what that meant, that I had to always be within arm's length of my son. And how would I get a shower? How would I go to the bathroom? All of those things without a nurse can be complicated, and certainly some families do that really well. I feel like I did that really well on some days, but other days it was near impossible. And I think that impacts the whole family. So when we look at even state to state, there's differences in care, and just like what Missy said, there's differences for everybody. Not every state has the same guidelines for who gets paid time off, who gets to be able to have those extra benefits that really should be a given.
Thank you. That's very insightful to help everybody really understand what it's like in the home and the level of exhaustion and stress. I can't even imagine. So let's move on to slide 7 here, and we got about 25 minutes left. I'd like to spend about 15 minutes talking through some of these solutions here, and then ideally we'll leave about 10 minutes at the end for any further kind of Q&A. But let's kind of circle back to where we started with the childcare crisis and women in the workplace, and let's talk about some of the solutions and advocacy happening there. Then we'll kind of pivot back over to Lourdes and Jen a little bit more and reflect a little bit more and talk about some solutions specifically for families with medically fragile children. But in the bigger picture, not just medically fragile children, but the other 99% of the population of parents that don't have a medically fragile child are still struggling, and massive issues there. So let's pivot back and start with you, Joy. And Joy, I know in addition to 2020 Mom, you've got two other nonprofits, the Blue Dot and Mom Congress. And do you want to pick a couple of the most impactful solutions and areas that you see are most important that we can educate people on, and maybe even give a few pointers to where people could go to get involved? And Missy, along with Exhale Parent, I think, feel free to chime in here along with Joy kind of as we go, okay?
Sounds good.
That's great. Thank you, Fred. Well, I'll focus on the Mom Congress proposed solutions. Mom Congress has been fortunate to be working with a partner organization, the Bipartisan Policy Center based in DC, who's long been studying solutions around childcare, recognizing that still so many families and women don't have access to childcare centers, let alone affordable childcare solutions. So they just don't have a choice but to provide care themselves and not be in the workforce or rely on family. What they have found through several surveys is that all women prefer, even if they have access to childcare centers, they all prefer access and choice to in-home care. Moms want their children to be near them if possible, if they're working at home. They also are really interested, as we saw during the COVID crisis, in this concept of pods. So even though moms want childcare in-home settings, they're okay with multiple families grouping together for in-home care in their home or at a neighbor's home, moving around together. And the Bipartisan Policy Center, as I alluded to, is really interested in this concept as a chance to rebuild childcare in America, not just reinstate or stabilize the existing childcare centers, which is still, of course, critically important for those of us who are already relying on those centers. Mom Congress has proposed a package of solutions, including what we call a NAMI. Most of us are, of course, familiar with the term nanny and often associate nanny with high-priced in-home childcare that most of us can't afford, and really believe we should all have access to that kind of a solution, and it should be affordable. Hence the new term NAMI, affordable in-home care. And we also recognize that there should be some sort of study on supporting mothers and families with medically fragile children. What does that look like? What does respite look like? This is just critical. Families have been suffering for too long in America, high rates of distress, trying to coordinate all of this, financial distress, figuring out the maze and the framework of support. It is just too much, and it leads to dysfunction in our families. That's not good for any of us. Our children are the next generation in the workforce, and we need strong, healthy families. And these are really important investments, and we believe bipartisan issue. Republicans and Democrats can all get behind. And back to the medically fragile children component, we know one state, and I know this will be alluded to here shortly, has addressed this, Colorado. We think all states should, and that it shouldn't necessarily be a state-by-state decision to decide what the baseline solutions might be. States should have the option to tweak solutions, but there have to be solutions. And so we really think some of this should be addressed at a national level. Fred, hopefully that helps, but just so grateful to be here today and to really have this group of advocates to get behind the movement in a larger way and to partner with. So thank you.
Thank you. That was perfect. It's one or two things that you mentioned. I just got the goosebumps thinking about the massive impact that would have on our entire country and just about everybody in it in such a positive way. So thank you for that advocacy. And Missy, with Exhale Parent, some very similar issues, and it sounds like a place that especially new parents can go to really help navigate their different options and everything. Could you talk a little bit about some of the solutions that you're advocating for?
Yes, absolutely. And so many things that we just heard are really resonating with me too. So thanks for rounding everything out here. Exhale Parent is really built around the moments when you become a new parent and how to best support your family during those very difficult times. And as we've talked about before, the United States does not have a national paid family and medical leave policy. And so as a result, there are really two main places that you could get paid family and medical leave. One is at the state level, and second is from your corporate directly. And what we see when I talk to businesses is that corporates do have a desire to want to support families. They do. They want to do the right thing by their employees. But I constantly hear, well, we want to support them, but gosh, how do we actually do this? Like, somebody's out of the workforce for 6 weeks or 12 weeks. We got to save their job, but then we also have to bring in somebody else and we have to pay them twice and we really can't afford to pay them. And so I think, we're at this point that corporates could solve it, but it's really hard to just do the right thing, offer a lot of time, incur a big expense when it's completely optional, right? And at the same time, the government is seeing more and more businesses step in, but you lose the equity in paid family medical leave when it's only coming from the corporates. And so I think we really need something to spark this cycle to make it easier and more normal for corporates to support their employees and for workers to have the assurance and the rights that they're really entitled to. And so that's why I'm so excited to see the proposal coming through tonight from Biden. In addition, I want to talk a minute about workforce equity. So far, we've talked largely about moms, but we haven't really named it as an equity problem in the workplace. I feel that parental leave is this moment in time when parents figure out who's the primary parent and who has the primary responsibility when the kid gets sick. And I feel so strongly about parental leave because it is that time when you're figuring it out. And if one parent is the parent who is better with a sick kid, that parent is going to be the one who takes time off from work to take the sick kid to the doctor or to care for that kid for however long it needs to be. And of course, when someone steps out of the workforce, be it for a period of time flexibly, or be it for a period of time just needing to be a little bit off for a couple of weeks, it can impact your long-term career. It can impact your bonuses. It can impact your pay. It can impact your promotion. And then down the line, you see when big moments like COVID happened, economically, the easier decision is that if one parent needs to step back, it's the one who's making less money. And that is largely tied to who is making the sacrifices early on to be with the children. And so when I think about, paid family and medical leave, I feel that it has this potential to not only support American families, but also to help create equity in the workforce for all types of workers, all classes of workers, but also across genders. And so, Exhale Parent is built out so that different classes of people, different genders can actually see the rights that they're entitled to and have the steps they need to be able to go and claim those rights. Because oftentimes there's just this information gap in not even knowing what you don't know and defaulting to the norm that you see. When in fact, there might be benefits available in certain states, cities, counties that you don't even know about. So there are many inspirations to having built out Exhale Parent, but certainly workplace equity and workforce equity are among them.
Fantastic. And I'd like to think this would be a win-win if states could get more involved, with that 1.5 million women exiting the workforce. If there was some sort of leave available, you may not have so many women and men in some cases too, being the primary caregivers, completely exiting the workforce. And so obviously there's a cost to the state maybe for funding some of that leave, but if it allows more people to remain in the workforce, you'd like to think that you get the benefit back with the economic gains and the taxes and everything else. So I'd like to think that this would be a real win-win.
And actually, Fred, you're bringing up a really important point that comes across as a little bit counterintuitive. So most people think that when you take time off work, then you might be less likely to return to work. You actually see the opposite. And California has been the big experiment on this because they've had the longest running paid family and medical leave program. Even if you just look at moms who take leave are 18% more likely to be in the workforce a year after they become a parent. So they get the time they need and they get their families set up and they find a daycare and they get through the first, many vaccine appointments. And then they're more likely to return to the workforce, which is better for companies to have the retention. It is better at the state level to have more people working, more taxes coming in. It's better for employee culture and business morale. There's just lots of pros to it, but I think it's easy for businesses to look in the micro and say, oh gosh, this employee is going to be gone for a little while, and not think long-term about the benefits of retention and reduced attrition and, higher cultural signaling of being able to support families. So there's a lot to unpack there, but actually, this is a really important point that leave actually inspires workforce retention.
Absolutely. Great. So let's pivot back a little bit to more the medically fragile children and their families again. And Lourdes and Jen, with your specific experience, I just want to talk real briefly about a program that we're really advocating for through the Unforgotten Families. And Joy, you made mention of it, a program that's existed in Colorado for 15 to 20 years now. Through some of the efforts of the Unforgotten Families and a lot of other great people and organizations and families out there, we've managed to take this program and get it legislatively approved in Arizona. And we have a few more states that we're working on with some legislation teed up. And our hope is that this program becomes more mainstream and eventually and hopefully soon in every state. And so basically what the program does is, we all heard from Lourdes and Jen talk about the difficulty of finding nurses being able or willing to take a significant reduction over what they can make in a hospital in order to be essentially paid through Medicaid to help care for these children in the home. And that care is so critical. One of the things that we really notice at Team Select and Tough is that these children are generally stable and yes, they're medically fragile as Jen really showed, having to be within arm's length of a trach at all times. But for the most part, they're stable. And because they're stable, they're authorized for home care. And they're entitled to, those children and those families are entitled to a certain number of hours based on the acuity of their child. And the challenge, though, is, and it differs by state, is because of the nursing shortage compounded by the fact that home health, taking care of a medically fragile child, is probably the lowest paid opportunity for nurses out there of any of the different places that they can work. You really got to find the nurses that have a passion for this kind of care and that financially are able to take that kind of discount. And unfortunately, it's an impossible problem. It was an impossible problem before COVID, and we see the results of this when families don't get the nursing that they're entitled to from Medicaid. What happens is two things: either those children end up with extended stays in hospitals or skilled nursing facilities at anywhere between $2,500 and $5,000 a day, instead of paying a few more dollars a day to home care to get these children home, so that companies can attract the nurses and we can attract more nurses to this industry. But what we've noticed is that because these children are stable, there's certain things that have to happen every day. The trach inventive children need their trach changed and they need their suctioning. The children with the G&J tubes need their proper feeding and nutrition every day. They need the proper bowel care so they don't get an infection. The other activities of daily living to keep them mobile. And when there's a nurse or a trained parent, like there is in Colorado, what we see is an 80 to 95% reduction in the hospitalization and back and forth of these children. And so really the model that Colorado came out with is instead of, you know, trying to think that the nursing shortage isn't real or the pay gap isn't real, they recognize well before any other state that this is very real and it's a problem that's only getting worse. And what we do in Colorado, and Team Select participates in this with a lot of other great companies, is we take parents and family members of medically fragile children. We train them for free at no charge. We put them through at least 80 hours of classroom training, 40 or more hours of on hands-on clinical training, and we actually get them certified as certified nursing assistants or certified home health aides. And what we do is we take either the lower acuity children, maybe children without a trach and vent, and through Colorado's you know, innovation and really tackling this problem in a practical way, we train those parents, and essentially we train and those parents become a member of a home health company, a clinician just like another nurse would be, and essentially they get paid to perform nursing duties. They don't get paid to be a parent. They don't get paid to tuck their child in or cook them breakfast. They get paid to take on the lower acuity duties that are frankly well below a nurse's educational level. The things like the bowel care, the G&J tube feedings, the bathing, the activities of daily living are very medically appropriate to delegate to a CNA or home health aide, especially in light of the nursing shortage and crisis. And so what happens is, you know, we see almost every day we're taking single parents in Colorado and of course married ones too. We're giving them free training for the country's fastest growing job. We're giving them a very fair living wage. If they work more than 30 hours a week, they get a full benefits package for them and the entire family. In a lot of cases, we're taking parents off of food stamps and welfare and giving them a middle-class job, and really giving them their pride and their dignity and taking control of their life back. And at the same time, we are taking those valuable nurses, and instead of having them work below their license level, we're able to pay those nurses more and really focus on the higher acuity cases, the trach and vented children, and have them work at the higher end of their license and free them up to become case managers, clinical supervisors, and actually provide a career path and allow them to help multiple families. And this program in Colorado has driven what we've seen as an 80 to 95% reduction in the hospitalization of these children, because what happens then is a parent or family member never misses work, they never call in sick, they're always there, and that child gets that care plan, every element of it executed every single day so that that child remains stable. It's when there's those gaps in care and there is no nurse that doesn't show up for a week or even a day, and you have a parent scurrying, unsure, untrained what to do. And so what we find is, you know, we're saving the state of Colorado, us and our other advocates and allies that provide this type of care. We're saving the state about 30% on every hour worked, because naturally they can pay a little bit less for us to staff a CNA than it would be to staff a nurse. But then they're also seeing an 80 to 95% reduction in the hospitalizations, which really drives the total cost of care. The thing to remember here is the home care is only 1.6% of the cost that Medicaid pays for medically fragile children. But by finding a smarter way to improve that continuity of care, it greatly reduces the total cost of care, and frankly frees up a lot more money for other needy segments of the population that Medicaid is trying their best to also fund. So I did go off a little bit on you know, my one solution here to it, but I'd like to, you know, Lourdes and Jen, I'd like to see, you know, maybe just a comment or two on, had this program been available in New Mexico for your children, how might that have kind of changed things? And then what solutions on top of that are the two of you really looking, and maybe even touch on the hospice space a little bit while I really touched on the home health piece?
So yeah, I'll go ahead and go first, Fred. So, you know, we've already talked a little bit about sort of the numerous medical nursing needs that are necessary within our own home. And certainly, I think when I think about the families, not just mine, but all the other families in New Mexico who decide to take this on, and this really is a labor of love. They are more than willing to receive the training. They're more than willing to do what needs to be done to keep their child safe with the highest quality of life possible, pain-free, etc. There was, you know, earlier in the conversations there was a little bit of the sort of this hypervigilance that the caregivers, would be it mom or dad or a family member who's being the caregiver for that moment. And certainly Jen alluded to the overnight, right? You're sleeping, you always sleep with one eye open, one ear listening. If my son made a little bit of a sound, you always had to wake up enough to say, is that an okay sound, or do I jump out of bed and make sure he's okay? And that is this sort of constant hypervigilance, 24/7, 365 for extended periods of time, right? Yeah. For my home, it was 13 years. For others, it's been 30 some odd years or longer. You have no idea how long it will be for. And I can tell you that I would be happy to have done this for another 30, 40 years to have my son here. So all of that is just, I just wanted to kind of sum that up. Because children are so-called living longer, right, due to medical advances, that's usually what gets credit for this. I think the other piece that I would love to mention is that credit also goes to these caregivers, to the parents doing this at home. As you've already mentioned, some of these individuals are not just giving medications, but they're managing ventilators, they're managing feeding pumps, they're imagining, oxygen, you know, it just, the list goes on and on in terms of specialized medical equipment. So I think there is sort of some credit there needs to be given to the caregivers at home. The possible solutions, I like the solution you've mentioned in terms of a family trained, whether it's the parent or a family member to do this. I think that would be a wonderful solution for many. Probably not all families, right? Because so many families are so different and have so many different needs. But different families find different ways. One of the things that's always brought up in terms of sort of, you know, I mentioned earlier the medically fragile waiver, it is supposed to be in place to sort of supplement and support the community supports that are in place and the natural supports that are in place. But in and of itself, it does not meet all the needs of the families. So I think we have to be very creative. I think we have to be open-minded. Your solution is one of I think would be a wonderful solution in New Mexico and would have been helping a lot of families in our state, especially when we get out to the rural parts of our state. And New Mexico is a rural state, right? So we are either left without any help at all. Sometimes if we can have, for example, a home health aide, which is certainly something that in our home we considered, that would have been very difficult for us in terms of usually home health aides are not able to administer medications. And my son had multiple medications throughout the day. So it's hard to leave your child when you have to be back in 20 minutes, in an hour to give the next medication. The other piece, and I'll let Jen speak a little bit more to this piece and why one of the biggest missions or goals for Heroes Path is that of respite care. And I know Joy brought that up a little bit as well in terms of respite care. New Mexico does not really have any agencies that can provide respite care for children who are medically fragile, individuals, regardless of age. We simply don't have it. It is a service that's available to us through the waiver program. We simply don't have anyone to provide it. And respite care would literally provide the much needed sort of relief, if you will, from being the caregiver 24/7, 365 for year after year. And I will let Jen speak a little bit more to the respite care piece, since we don't have it really available. It may be on the list of menu of services, but we really physically don't have access to that.
Yeah. And I'm just going to make a quick executive decision that we're at an hour, but let's just keep going. Let's spend at least another 5 minutes or whatever we need to properly finish up this topic. So don't worry about the time, Jen.
Yeah, I think probably what's going to make the biggest impact is that we see groups like all of ours working together to solve the problem. So there needs to be options. What's going to work for my family with a trach and vent kiddo is not going to be the same solution for somebody who is a single mom and is trying to work and take care of her children and needs a pod of families. And so I think the key is to have options. And I think that's what Team Select does a good job of, is the families who can and want to use the home health and CNA, getting trained and being their own child's CNA. I think that is fantastic. I think that gives them a way to be able to care for their child and make a living, because none of the child care centers can take our children. So we can't just find a different child care provider. So I think that's a really great solution. I think that we need, that full team of support. So palliative care, home-based palliative care is really important. We need a whole team surrounding these families because their needs are complex. They need help with so many different things. They need help coordinating care. They need help with making tough decisions that no parent should have to make on their own. These families need respite. We can't just call a babysitter. For me to have a date with my husband, I needed a nurse and a babysitter to take care of all of my children. And that was nearly impossible to coordinate. So I think respite should be available in people's homes. It should be available in a facility if that's what works best for them. It should be available as a day service. We need to think about these children holistically. We need to think about how can we get them to be a part of our community? What does it take for us to see these families out? Can these families be part of a pod? Can we have this whole community come together and see that we're all similar? We all have important needs, and can we benefit each other that way? I think the goal is to work together as advocates and continue to, I think our causes are additive, and that we're going to make a big difference if we continue to see the needs as bigger than just our cohort. And I think that's what this discussion has really highlighted, that we all can work together in a way that makes a difference for everybody. And I'm really pleased to hear from the other panelists and their drive and their passion and compassion. And I think that we are going to see some big changes because of people who have decided we are going to advocate. We aren't going to be quiet. We're not stuck with just what's going on with our family. We're looking at it as a whole. And certainly companies like Team Select, they're on the cusp of really doing something huge, making an incredible impact in our communities. And I think that's what we need more of. We need more people linking arms together. And I think that's how we fix this problem, because there's not going to be a simple solution. But I think we have it. I think we have the momentum, and I think we can do it.
I think so too. I'm really humbled to be the moderator today and have such an impressive and amazing group of panelists. And I'm very excited to lock arms with all of you going forward and supporting each other's missions. And I would love a chance if there's anybody in the audience that has any questions for us. We'd be happy to address that.
So this is Christina speaking. I've been texting and emailing with the media. Some people had to drop off and they're looking for the recording. So, they had other calls they needed to get to, or other meetings, or just other work in general. But really excellent job, everyone. Thank you so very much. This was so enlightening. We got so many beautiful sound bites. It was just so, just as someone that's been close to it for so long, just even hearing other facets of the story, and for, Jen and Lourdes to share their very intimate experience. It's amazing, and we appreciate you. So again, we have recorded this. I will obviously edit this portion out where I am speaking. Some media have asked for it. We will share it also we can share it with all of you. We're going to be sharing it with Team Select so they could use it for sound bites on social media. We'll be using it for pitching. But you guys are all fantastic. I appreciate you. It has been such a pleasure working on this with you and everything else. And I am an only email away if you need anything. But thank you for your time, and thank you for the going over time, because we appreciate that.
Thank you all so much, Christina.
Nice to meet
Thank you so much for organizing.
Yes, my
All
pleasure.
right.
My
Thank
pleasure.
you all. Looking
Thank
forward to
you.
continuing our relationships.
Yes.
Bye-bye.
Bye-bye.
Bye.